So thank you all so much for joining us for the history of contagious disease hospitals in Massachusetts. We're going to explore the complex history of contagious disease hospitals in this state from the 19th to the early 20th century, highlighting their role in shaping public health policy, immigration control, and institutional development. Tonight's presentation is led by Dr. Katherine Benson, MFA, EDD, an institutional historian and an award-winning author. She has been a special educator for more than 20 years in residential treatment facilities, juvenile corrections, and therapeutic programs. Dr. Benson has written about and lectured on the history of institutional treatment in Massachusetts. She lives in Western Mass with her husband, a very bitey cat, and a special needs dog. And again, tonight's program is sponsored by the Public Health Museum, presented with support from the Tewksbury Library. So, nearly 200 of us who are watching live, and the many more that will watch the recording. Let's give a big virtual round of applause to Dr. Benson for joining us tonight. Dr. Benson, you can take it away. Thanks so much.
Excellent. Thank you. And thank you for having me tonight. I'm very excited to talk about this topic. This is a new research interest of mine that has grown out of my many books about asylums and other institutions. So I'm hoping that together we all get to learn something. And I'm so appreciative to see just how many people, not just from Massachusetts, but all over the place, have joined us for tonight. A couple of people have mentioned that there's a little bit of an echo or perhaps feedback, and someone has suggested to log out and log back in. That usually will fix the issue. But if you continue to have issues, please let us know. All right. So a little bit about me. So as Robert mentioned, I have been in special education for over 20 years. I'm actually going into my 25th year, but I'm not quite there yet. I am currently the special education and curriculum director at Lighthouse Holyoke. I'm also a public health museum board member. I also work for the Springfield Preservation Trust. I live in Western Massachusetts. I was born in Springfield. I grew up in Agawam, where Six Flags New England is. And I'm also the chair of the education committee for the Springfield Preservation Trust. And I am the co-chair of the Massachusetts Special Commission on State Institutions, which is a commission formed solely of individuals with disabilities. And it is the first of its kind in the world. And a big part of what we do is maintaining this type of institutional history. I'm also just a history addict. I love everything about history, even though I have never taught history, which most people are very surprised by. But I have loved history since I was a kid. And given my career, I started out in residential treatment facilities for kids who had been removed from their homes and had mental health issues or developmental disabilities. And I did work in juvenile corrections for a time. I have worked in a number of therapeutic programs. And understanding and learning about the history of institutional treatment, I've found has made my practice a lot deeper and a lot more meaningful. And part of that history that I have been looking into is a connection between the institutions that I have spent 20 years researching that is connected deeply to these contagious disease hospitals, which then brought me to investigating immigration and different issues to do with how we care for the most vulnerable parts of our population. And I do see folks still struggling with echoes. If you did load Zoom.
Dr. Kate, I'm going to pop back up. So 3 people have complained of echoes. 2 of the 3 have solved the issue.
Perfect.
You're getting an echo if you're logged in more than once. So several people are logged in for whatever reason more than once. And
Yep,
in that
that's true.
case, you're going to want to close one of your browsers. Okay. If you're
Perfect.
logged in more than once, you're going to get an echo. But it's been resolved. And Dr. Kate, I would recommend ignore the chat. Leave the chat to me. Don't worry about the.
It's hard when you're a teacher and you taught on Zoom for 2 years, you pay attention to everything. So when I started thinking about contagious diseases, it's easy to think about things like scurvy that came from, sailors not getting enough nutrition on board ships, and then they were more susceptible to other diseases. And you think about um, the entire process of coming from Europe and colonizing the New World. We think about smallpox blankets being handed out to the Native Americans, and some of the ways that some of the early colonists felt about contagious diseases. When a lot of people had come over to the New World, there was a major class distinction on those ships. Most of the wealthy passengers who were coming over, they had paid their own way on the boats. They could afford cabin passage, which meant they had private or semi-private sleeping quarters. They had much better food and more comfortable conditions. And frequently they traveled with their families, their servants, or even enslaved people that they were bringing with them to the New World. Even middle class and working class passengers might travel as paying passengers, but most of the time they were in steerage below decks. They had minimal space, basic food provisions, and in many cases, unsanitary conditions and few rights aboard the ship. They couldn't go up and get fresh air whenever they wanted. There was very little cleanliness. You can see in one of these illustrations, sick people kind of congregated in one place, which would lead entire voyages to potentially become floating epidemics. And those contagious diseases were significantly more common and deadly among steerage and lower class passengers. The upper class passengers were typically in better health to begin with because they were able to afford medical care before they even got on the boat, and they were able to avoid contact with people on the boat who might be sick. There were rarely doctors on board these boats either, and if they were, they would serve the paying passengers first before they would check on the people in steerage, where epidemics were most likely to spread like wildfire. On some voyages, as many as 1/3 of the passengers in steerage would die before they even made it to the shores of the New World. There was terrible hygiene, inadequate food and water, and limited medical care. And imagine being cooped up in these steerage bunks with human waste, vomit, spoiled food. And in a lot of cases, that food was spoiled before it was even provided to those passengers to eat. So imagine all of that sitting around in those damp quarters below decks, and just thinking about how quickly illness can breed and foster in those situations. So when passengers were ready to disembark, it presented an even bigger problem. The people in the New World were getting word that more and more of these ships were coming in with these epidemics and outbreaks, causing massive death rates. So if a death rate had spiked too high, a lot of the colonies that were port cities would set up quarantine stations in the ports themselves so that they could refuse entry to any ship or vessel that was reporting a high level of illness. And some colonies actually took the time to enact some public health laws that would require the shipmasters to report the level of illness on the ship before they even docked. They prohibited the passengers from disembarking without being inspected first, or they couldn't get off the ship unless they had been inspected. They also would impose fines on some of the captains if they violated quarantine orders. There was always a chance that someone who was ill could slip through the cracks and make it in. But the colonies were working really hard to respond quicker to the report of disease, and they started creating rudimentary public health infrastructure that they could at least try to prevent further spread of these diseases once the passengers hit the shore. So one of the first places that they considered to help them contain all of these diseases was, of course, the water. These ships are coming in. The people in the New World don't want these ships hitting shore until they're certain that people are not coming into their colonies and infecting others. Because of the level of healthcare that existed in the New World, these epidemics could not be fought. There were no inoculations at that time. So the only way they could be sure that they were safe was to quarantine as many of the sick people as they possibly could. So they started out by establishing these quarantine stations offshore where they could hold these passengers as long as they needed to, or in fact, make the decision to send them back. So in Massachusetts, the first offshore quarantine island was Rainsford Island, which was also referred to as Hospital Island, Pest House Island, and Quarantine Island. And any ship with signs of disease would be stopped at Rainsford, inspected by port health officials. Those who were sick, or if they were dead passengers, they were detained on the island. The dead were buried. The sick were cared for the best that they could. All of the cargo from the ship could be fumigated and sent to shore or held if they couldn't clean it. And any passenger with any kind of symptom of contagious disease could be removed to an isolation hospital that had been built specifically on the island. And here's some images of the hospital at Rainsford Island. The top left image is one of the contagious disease wards. The image on the right is the cemetery, where when the dead came in, a lot of the ships would come with makeshift coffins or burial shrouds because there were so many people dying on the ship before they touched land that they knew it was going to be an immediate burial when they got there. So on Rainsford Island, there is a very large unmarked burial ground. The bottom pictures are from the abandoned buildings on Rainsford Island. So if there was a chance that an infected passenger could slip through the cracks and evade quarantine, or they didn't show any symptoms until after they had disembarked, the disease could spread so quickly in those crowded port towns. And the most concerning diseases that they were dealing with were smallpox, yellow fever, and typhus, and all of which we don't see very many cases of any longer thanks to inoculations. Some towns realized that there were folks who were slipping through the cracks, so they responded by implementing house-to-house inspections. And if they found a family member who was ill, they would immediately isolate them. And then there were mass inoculation campaigns when they finally did have what they considered to be a working vaccine. But when these outbreaks happened, it looked a lot like COVID. Schools were closed, markets were closed, churches were closed. People recognized that many of these diseases were spreading because of people-to-people contact. So the more they could stay away from other people, the better off that they would be. However, this led to an attitude towards contagious disease that was influenced greatly by racism and classism. In very many cases, immigrants and the poor who had come to America were often blamed for these outbreaks, specifically the Irish, German, and Jewish immigrants, who were especially targeted in the 18th and 19th centuries. often, if a family had come over and they were sick and they had to be quarantined, when they were better and tried to go back out into the community, they frequently could not get a job. Sometimes they were refused services in a number of places. And there was a great feeling of social stigmatization that came with contagious diseases, even if they had recovered fully. And those who died from contagious diseases were often buried really quickly. Sometimes they were buried in mass graves, and not mass graves that weren't labeled, because of the fear of people going near those bodies, especially around the time when there was a regular practice of grave robbing. Medical schools in the early days did not have access to cadavers in order to teach. So very often people would dig up cadavers and sell them to medical schools. And it was a very lucrative profession at the time. But those resurrectionists weren't necessarily well educated, and people were afraid that if they marked the burial grounds of these individuals who had died from these highly contagious diseases, that they ran the risk of the grave diggers also getting these diseases and bringing them back into the township. So a lot of the graves were not labeled. However, some families did have separate burial grounds outside city limits, sometimes in their own yards, but also sometimes there were larger smallpox cemeteries and other contagious disease cemeteries that were located outside of the city limits, so that people could have a place to know that their family member was buried, but it was away from the rest of the town, so that they didn't risk, because they didn't know if it was contagious after death or just when people were alive. So they weren't going to take any chances. The other island that also served as a quarantine station was Deer Island. The island was originally used during King Philip's War as an internment camp for Indigenous people. But by the 19th century, the island ended up being a landing point for thousands of refugees from Ireland. And again, this is around the time that that social stigmatization piece came into play, because there was such a feeling of fear and loathing of the Irish, that now the Irish are coming in already ill or compromised because they haven't had adequate food, they haven't had adequate medical care, and they're coming to the New World for these opportunities, but that contagious disease piece was getting in the way. So in 1847, the hospital was established on Deer Island to treat incoming immigrants, and about 4,800 men, women, and children were admitted over the life of the hospital. And it served a very important purpose in 1918 during the flu pandemic, where they spent time trying to develop a vaccine. However, as often happens with institutions that care for the poor or for immigrants, the quote unquote volunteers who were inoculated against the flu were actually prisoners. There was also a prison on the island, and the doctors who were experimenting with inoculations were using prisoners as their test subjects. None of the volunteers got sick from the inoculation, which was a success. However, the ward doctor who was caring for them did contract the flu and die. The doctor who was in charge of the experiment, Joseph Goldberger, did publish a report on the experiment in 1921, but did not mention that the volunteers were prisoners, and it only briefly mentioned that the ward doctor had contracted the flu and died. So in 1896, the entire facility, which had also been used as an almshouse for the poor, was turned into a short-term prison for Suffolk County. And the Deer Island House of Correction actually existed until 1991, when all of the prisoners were permanently transferred to the South Bay House of Correction. The Deer Island prison is so emblematic of this time and so etched into the minds of the people in and around Suffolk County that it actually shows up in one of Sylvia Plath's poems called Point Shirley, and it also appears in her novel The Bell Jar. It's a little interesting facts for you that go along with some literature. Another island hospital was Essex Hospital, and it was on an island called Cat Island, which is now called Children's Island. I did not look into the reason why it was called Cat Island, but now I feel like I might need to know, so that might be a follow-up question that I'm going to have to do some digging on. Being from Western Mass, all of these little Boston islands are new to me. But in 1773, the town of Marblehead had an epidemic of smallpox. So Essex Hospital was built on Cat Island, and it was a relatively small hospital. And their entire purpose was to find a working vaccine. So they effectively inoculated quite a few people between the years of 1773 and 1774. However, interestingly enough, a year later, the residents of Marblehead had gotten so paranoid about this hospital and the inoculation piece that they actually burned the hospital to the ground. It's important to think about the time and place in which these hospitals existed. When the New World was colonized, even though most of the people coming to the New World were looking for religious freedom, their religious beliefs then impacted how they viewed things like contagious diseases. And sometimes that religious fear clashed with scientific approaches, particularly when they started to introduce these inoculations. A lot of people resisted the idea of inoculations because it was tampering with divine will. If God had sent this disease, intervening medically was seen as a lack of faith or even blasphemy. But on top of that, it was layered into just the general fear of contagious disease and the fear of death in general. In colonial America, we have to think about the fact that people were dying young. There was not quality medical care. There was not a great deal of food available. Shelter was meager at best. And then that fear gets intertwined with religious belief, superstition. All of these disease outbreaks were frequently interpreted by the Puritan people as not just a physical affliction, but also as a spiritual warning, divine punishment, or a sign of some sort of moral failing, that you had to be a certain type of person to be impacted by these contagious diseases. And this shaped how people responded to these illnesses, how they treated the sick, and how they interpreted these public health crises. If you're looking at contagious disease as a divine punishment, and then interpreting it further as an impact of your moral failing, that's going to change how you isolate and how you treat the people who are now in a position where they need to recover from this disease and they need to come back out into the world. But a lot of the ministers were preaching that these outbreaks of smallpox, yellow fever, dysentery were warnings that people needed to repent, to pray, and to return to godly living, which is a complete antithesis to what the science was telling the early medical practitioners. In many cases, when these epidemics broke out, those island hospitals were wonderful, but there were also areas in which, when the suburbs started to grow outside of these major cities, where care was necessary in those particular areas, especially the more rural areas. So for a very long time, towns were engaging in the creation of pest houses and temporary smallpox hospitals. So in Worcester and the surrounding areas, rather than having custom-built hospitals in the center of the city, they started operating out of already existing buildings. And in most cases, it was people's homes. So in 1752, patients were being treated in the home of Robert Crawford on Green Hill Farm. And this was now that they were learning that they could do this, they could take these houses that were already somewhat isolated and use them as a temporary hospital. This practice began to spread. So in August of 1776, Worcester County granted permission to a number of individuals to establish temporary smallpox hospitals, one of which was in Fitchburg, and run by Dr. Thaddeus McCarty. And then Worcester County realized that by taking these proactive measures and establishing these small dedicated care facilities, that kind of disease response would actually lead to a decrease in the spread of the disease. And eventually the necessity for these smallpox hospitals lessened after they had developed the first successful vaccine. And that replaced the original inoculation method from the 1700s that people were very, very afraid of. So there was a slight movement from these large institutions out on islands to coming into treating people in their own communities. However, there was still the need for large-scale hospitals to treat these contagious diseases. And in many cases, because the island hospitals were in effect seasonal, they were not permanent solutions, especially for the colonies that were landlocked and needed to continue to care for people who developed symptoms long after they had come to the United States. So by the early 1800s, most colonies were looking at their already existing almshouses, their poorhouses. These places were already housing a mix of the poor and the homeless, the elderly, people with disabilities, anyone with chronic illness. And most of the time, these almshouses were within reach of these super crowded cities. So city and town officials began to think about whether or not the almshouses could serve as further sites for caring for individuals with contagious diseases. The people in the almshouses were already socially, physically, economically marginalized. They were already in an institution, isolated and separated from everyone else. Why not add on the ability to care for people with contagious diseases? So this image is of the almshouse in Salem. And it was the last almshouse to be built. It opened in 1816, but they very quickly added a contagious disease building that relieved some of the overcrowding in the main hospital, which was only built for 100 people. And then it was an opportunity to further separate the people who were sick from the other poor and indigents in the almshouse. And some of that thinking was positive thinking of separating and isolating the disease itself. However, they also wanted to separate and isolate those folks so that the ones who were not sick could continue to work at the almshouse, doing whatever it was that they were meant to be doing to work off their social welfare piece. They didn't want disease spreading any more through the almshouse than it absolutely had to, because they wanted these people out working on their farms, continuing to work in the industrial shops, making shoes and brooms and mattresses and things. So separating the individuals with contagious diseases actually served a number of purposes in the almshouses. And this was a practice also in the insane asylums in Massachusetts around the mid to late 19th century. And a lot of these tuberculosis and contagious disease wards continue to exist up until the 1950s and 1960s. So these are two private homes that were pest houses specifically for smallpox quarantine. One is the Potter House in Concord, the other is the Pest House in Mendon. They are both now private residences. These are pictures of them currently. I could not find historic pictures of them, so if anyone happens to see some great historic pictures of these two pest houses, that would be awesome to see. But some of these houses were actually just requisitioned by the county and used as pest houses. What I thought was interesting was the selectmen of the towns ordering homeowners to hang a red flag from their house so that everyone would know that the contagion was contained in that house, but not to go near it. And when we think back to some of us as children, hearing some of the nursery rhymes, or also hearing some of the urban legends or the old wives' tales that told you to, if you saw the red flag, to cross the street. This is where it comes from. The fear of these contagious diseases also often got translated into everyday parts of people's lives, especially the way that contagious disease like the plague infiltrated things like nursery rhymes and children's stories. So obviously, death from any kind of disease is terrifying, in part because people were afraid of dying suddenly, especially if they were religious or spiritual in any way. Many people were afraid of dying and not being spiritually prepared for that. Often people with contagious diseases died so quickly that they didn't have an opportunity to have last rites, they didn't get to confess, or they died in an institution and their family wasn't present. And again, being buried in unmarked graves was associated with spiritual unrest. And in some cases, it was a form of dishonor to be buried without any kind of acknowledgement. So people who were dying of contagious disease, it heightened the communal anxiety. They were so afraid of the spread of this disease that often people would be buried within hours of their passing away. Sometimes they or all of their belongings would be burned in order to kill the remainder of the disease. And because there was a lack of understanding of how these diseases were spread, the panic just amped up. But bodies were often wrapped in cloth, or they were wrapped in shrouds. Sometimes they were tarred in order to keep the contagion inside. Very rarely did anyone take the time to embalm these bodies, mostly because they were afraid that A, touching the body, and B, taking the bodily fluids out could cause exposure and infection. So a lot of times when disease struck like this, the communities had to kind of balance out that need for the hygiene and containment with their desire to carry out their spiritual rituals and maintain respect for the dead. The middle image in this particular slide is a grave of Sarah Wilton. She is buried in the Tewksbury State Hospital Cemetery. However, she was not a resident of the almshouse at Tewksbury. Her mother, from the looks of it, was a single mother. Her name was Hannah. She came to the United States from Ireland, and she came through Rainsford Island. The assumption is that Hannah was likely already sick when she came to Rainsford. She was also heavily pregnant. So Sarah, her daughter, was born on Rainsford Island in the pest house. And unfortunately, because of the rampant disease on Rainsford Island, Sarah died very shortly after Hannah gave birth to her. She is buried, as I said, in the Tewksbury State Hospital Cemetery. She is one of the few that has a headstone. And you can see that many people still leave her gifts and toys and things like that. But her grave originally would have been likely an unmarked grave, and someone added that gravestone later. But her story is one that's very interesting, but also not uncommon for that time period. After smallpox, typhus, dysentery, and all of those contagious diseases, the next biggest health crisis that we experienced was tuberculosis. The tuberculosis bacteria was identified in 1882 by Robert Koch, but there were no antibiotics. Those didn't come along until 1944. So there was a type of vaccination for tuberculosis that was being used in Europe. However, the US did not want to adopt that vaccination process as it was controversial. So instead, the US continued to rely on quarantine. This image here is from Westboro State Hospital. Many of the state hospitals and other state institutions, such as state schools, prisons, reform schools, all implemented a system of regular chest x-rays for their staff. However, the records of x-rays, chest x-rays for patients seems to be less regular and less regulated. So while they were trying to keep their staff healthy, they weren't necessarily using the same level of prevention with their patients and residents, which is really interesting. But as these continued diseases impacted how we were caring for the poor, the disabled, the elderly, a lot of reformers were pushing for a particular type of quarantine laws. They wanted these special hospitals built. They wanted visiting nurse programs, and they wanted tuberculosis cases to be reported so that they could be tracked, which is something that they also implemented during COVID. So tuberculosis was, before there were antibiotics, before there was a vaccine, the only widely accepted type of treatment was rest, fresh air, and nutrition. So when they started to build sanatoria in order to take care of specifically tuberculosis patients, many of these sanatoria were beautiful in their architecture, but also had beautiful outdoor spaces. A lot of the medical interventions that they were using were social interventions, getting people out into the fresh air, feeding them diets that were really high calorie diets. They believed that that would help some people. Some hospitals even used milk treatments. There were a number of different practices that were tried in order to stave off the damage from tuberculosis. In 1898, Massachusetts actually built the first state-operated sanatorium for tuberculosis in the United States, and it was Rutland Heights. There were a few medical interventions, a few surgeries that were being tested out. If anyone has watched the TV series The Crown, they show the process of King George having part of his lung removed. That was actually one of the more popular ways that any kind of lung disease, including tuberculosis, was removed from the body. Tuberculosis was, and still is, a very nasty disease. They nicknamed it consumption because of the way it consumed the body of the person it had infected. The person would waste away, and it was a horrible way to die. And of course, it disproportionately struck the poor, the working class, immigrants, and any institutionalized population where that disease could spread, again, like wildfire. However, strangely, tuberculosis is the one contagious disease, besides perhaps scarlet fever, that gained a romanticized view, especially in Victorian literature. Many artists, poets, and delicate beauties were linked to consumption. It slowed down the way people reacted to tuberculosis because it had been so romanticized. Even as I was preparing this presentation, I thought about one of my favorite children's books was called The Doll in the Garden. And in the story, there's an older woman who talks about her friend Louisa, who died of consumption as a child. And Louisa is portrayed as this beautiful waifish little girl with the white Victorian nightgown and the curls, and she's coughing up blood into a handkerchief. And that was a children's book. So tuberculosis being the leading cause of death in most industrialized nations by the turn of the century was also, again, a subject of children's literature. So we also have a state sanatorium out here in Western Mass, and it was opened in 1907 in order to care for patients in Western Mass who didn't want to travel out to Rutland. And Westfield is unique in that they actually admitted children. So they expanded their ability to treat more patients by also taking in children. And eventually, drug therapy for tuberculosis came along and started to reduce the need for the sanatoria, and the hospitals started to phase down. And this particular hospital is still in operation. They began taking patients with other chronic diseases in 1959, and that's what they specialize in today, and it is now called Western Mass Hospital. And our other isolation hospital here in Western Mass is the Springfield Isolation Hospital, also known as the Municipal Hospital, also known as the Black Death, according to my grandmother's aunt, who worked in this hospital. Before the 1930s, when tuberculosis became an issue in the industrialized cities of Springfield and Holyoke, there was an almshouse on this particular property. But in the 1930s, the city constructed the isolation hospital because they were having an issue with tuberculosis. And in Springfield, even though we had two city hospitals, they were relatively small and couldn't continually care for the sheer number of people who were coming in with tuberculosis. There was also a second contagious disease hospital in Holyoke, which I could not find a great deal of information on, but it is now the site of the Holyoke Soldiers' Home. There are a number of more consumptive hospitals. TB caused more deaths than any other disease in the city of Boston. It accounted for roughly 10% of all deaths in 1906, which is a huge percentage. And there was also Lakeville tuberculosis, which is best known for its use of the iron lung, which you can actually see an iron lung in person at the Public Health Museum, if you're interested. And in 1944, when they started introducing antibiotics, they changed the way that they cared for people with tuberculosis. And most of the hospitals were converted into something else, like Belmont Hospital in Worcester. It was specifically built as just an isolation hospital, and then they added a tuberculosis ward, and they also played a very important part in the influenza pandemic. However, by the 1950s, the hospital was converted into a long-term nursing facility called the Belmont Home, and from what I understand, that building has been demolished, and there is another assisted living building on its property. So finally, after all that talk of contagious diseases, many of these buildings have been demolished. They've been repurposed. Some of them have caught fire. The isolation hospital in Springfield is now on the most endangered list for the Springfield Preservation Trust. They are talking about demolishing that as well. However, there is the one remaining constant reminder of a time when these infectious diseases were so prevalent, and that's the cemeteries. So institutional cemeteries are often unmarked, they're often forgotten, the records are difficult to access, and in some cases, people are not sure what these cemeteries are and what they stood for. But in Massachusetts, there are 13 distinct smallpox burial grounds. Of course, there are other cemeteries where smallpox victims might have been buried, but there are 13 that specifically say smallpox hospital. And these sites span various time periods from the 1760s right on through to the mid 1800s. So you can see some of the evolution of the outbreaks, but also the evolution of the public health responses as you look at the numbers of victims and how they decreased over time. And there are some areas like Cape Cod where there are several of these cemeteries, obviously because they are close to the ports. And to think about the fact that there are 13 specific cemeteries in Massachusetts that are dedicated to contagious disease victims, but also thinking about all of the other unmarked cemeteries that exist. The example of Sarah Wilton buried at the Tewksbury State Hospital Cemetery, that these individuals were isolated and marginalized, in many cases, immigrants, people who were poor, people who are disabled, elderly, mentally ill, all in one place. And we look at just yet another layer of isolation and marginalization with these unmarked cemeteries that also kind of bleed into the unmarked cemeteries of the other institutions in Massachusetts. And it's very interesting to think about how going forward, when we think about this history, how can we continue to share this history so that these burial grounds don't get absorbed into a lack of knowledge and understanding. And I recognize that it is 7:49. So I would love to take some questions, and I feel like I blew through that. So hopefully everyone got a chance to hear everything that I said and take a look at the pictures. So I'd love to take a couple of questions.
So folks, let's give Dr. Benson a big virtual round of applause for a great presentation. And we have plenty of time for questions. An anonymous attendee asks, is Ransford Island still in existence today?
So yes, the island does still exist. However, it's no longer accessible. There was an issue with the bridge that used to go to the island. There was a safety issue. So they took the bridge down and they have no plans right now to rebuild it, which I think is very strange and very interesting. But the building, some of the buildings, original ones, are still there. The burial grounds are still there. So it's it would be a great place to see some real serious research happen.
An anonymous attendee writes, did people have a choice as to whether their house was a pest house?
So from what I can gather with the way that they described the pest houses, some of them were voluntary, that folks said, hey, I'm a physician. I'd really like to open my house to these individuals to treat them. But in some cases, it does sound like some counties did actually force that and requisition houses. I would really like to do more research on that and find out what that process looked like, because to me that's very reminiscent of the Civil War and the Revolutionary War, where they were requisitioning homes for soldiers to be billeted or requisitioning homes to use as field hospitals. So it would be really interesting to find out more about that.
An anonymous attendee writes, what type of preventative measures did folks who worked at these hospitals take in the 18th and 19th centuries? For example, did they wear masks?
So yes, they did. Their masks were cloth. They typically made them themselves. Sometimes you can see in some pictures, you'll see the nurses all decked out in their uniforms and they have these tented cloth masks, a lot of extra hand washing. And I have to assume, especially nurses who lived on the campus of these sanatoria, because a lot of the staff did live on campus, I have to assume there was a lot of extra laundry happening. I would imagine they probably had to change their uniforms daily. I would assume some of the practices that came out of that were probably, you know, going home and taking a shower or washing your face and, you know, not touching anything else until you've fully cleaned yourself off. Obviously, all of that has evolved because we have, you know, soap that's got actual antibacterial properties. Their soap back then was probably just lye. But I have to assume that that started a lot of the public health practices that we use today.
Follow-up question from Suzanne. The medical personnel who worked on the island hospitals in the 18th and 19th centuries, did they live on the island or did they travel back and forth to their homes? Did they worry about infecting their families at home?
My understanding is that most of the staff did live on the island. Um, in general, these large-scale institutions were built to house the majority of their staff. It doesn't mean that there weren't some people who were traveling back and forth to their homes, and I can't imagine the worry that they would have carried. At least, you know, when we have epidemics now, we know that there are antibiotics that we can take. We know that there are hospitals available where we can be treated. But thinking about, you know, the 1800s, these are folks that are going to go home to their family and think, well, if someone gets sick, we have no way to treat them. So I can't even imagine what that felt like. But yes, most of them would have lived on the island, which would have also stemmed some of the infection, one would hope.
An anonymous attendee asks, are any of the hospitals on the remote islands accessible to the public today?
So in the research that I have done, the answer to that so far has been no. Deer Island has been completely redeveloped. So from what I understand, there really are no remnants of what was out there. And obviously the Essex one out on Cat Island was burned down. And from what I understand, now that it's Children's Island, it too has been completely redeveloped. Rainsford Island, or Long Island as they call it, is the only one that has remnants of the hospital. However, it is regularly patrolled. You can't get to it except by boat, which is super very illegal.
Speaking of super illegal, Katherine asks, can smallpox still be contracted today from cemeteries if you're digging up a gravesite?
That's a really good question. And from what I've read so far, the answer to that is no. I would love to hear from other, you know, epidemiologists and other researchers if there's ever been a case where something like that has happened. I would have to assume that whatever bacteria or virus any of these bodies carried at one time has to have broken down by this point, especially since specifically with like smallpox that was carried on the skin. If there's no more skin, if that's decayed, there shouldn't be a danger of infection at this point.
Nancy asks, were any dead bodies ever buried at sea?
So yes, they did. I did find a couple of mentions of them just dumping bodies over the edge because some of these journeys would take months. So if you had an outbreak in the middle of the ocean and your fear is that these dead bodies are going to continue to infect others, they wouldn't hesitate to get rid of those bodies, and they would report the deaths once they got into port. But obviously burial at sea was much easier for them than holding those bodies, and especially since there was no way to keep those bodies from also, on top of everything else, decaying and causing other sanitation issues on the ship.
An anonymous attendee asks, can you share some of the titles you have written or any recommendations for further reading?
Yes, absolutely. If you go to Amazon and you search Hospital Hill, that's my one title that is easiest to find me by. If you hit my name underneath Hospital Hill, it will give you all of the titles that I've written. I do have another book that it will be coming out probably sometime early next spring about unmarked cemeteries in institutions. And as well, I have a book coming out about the reform schools in Massachusetts, which should also be out probably sometime this spring, depending on how fast I write. So you can find everything on Amazon. I am still working on a recommended reading list, but right now what's top on my list is John Green's Everything is Tuberculosis. There's also a book called Damnation Island, which is phenomenal. There's lots of really beautiful books. I'm just starting to get into the contagious disease part of this history. So as I find more interesting books, I will likely update my reading lists on my website.
Excellent. We'll take some more questions. Kimberly asks, and I promise all the questions will be looking back in history, but I'm going to ask this futuristic one from Kimberly. Do
Sure.
you think we're likely to have contagious disease hospitals again if disease frequency and impacts get worse?
That's a question I've been pondering for a very long time, because obviously I've already been thinking about that question when it comes to institutions for people with mental health issues and developmental disabilities, just because of the way our world is trending. But the contagious disease piece is fascinating because we see this sudden rise in all of these diseases that we had eradicated. Some of it is from people who are not vaccinated, but some of it is also organic. It's happening in other countries. And when people travel or they come in contact with other people who, live in the United States, and that starts to spread, we're seeing a resurgence of tuberculosis. There's been a resurgence in very small pockets of polio. We've seen lately it's been measles. Measles has been the tough one. But even on a small scale, we're seeing a sudden resurgence of people getting mono. And it's people who you don't expect to have mono. I think everyone associates that with teenagers because it's the quote unquote kissing disease, but we're seeing elderly people contracting mono. And it's strange to watch this happening. Especially I'm a child of the 80s. I can't even tell you how many inoculations I had. And we're learning now, the closer we get to 50, that some of those inoculations don't hold out past 50. So we have to start looking at new ones. So that's a long-winded way of saying I think there's a chance we may be looking at some sort of contagious disease treatment. I don't know if it's going to be, they're going to start small with specific wards and hospitals, or if they're just going to go full tilt and start building isolation hospitals again. I don't know, but we're going to have to do something at some point if these resurgences grow.
So we'll go 5 more minutes because I think I had you start speaking around 7:05. So we'll go 5 more minutes. People have lots of questions about lots of specific hospitals. I'll ask a few. Paul wants to know, where was the Boston Consumptive Hospital?
So the Boston Consumptive Hospital is in Mattapan. The building, from what I understand, is still there. I think they're beginning to parcel out the acreage to have it redeveloped, but I'm not sure, because now that you've asked, now I'm going to look it up. Let's see if it gives you. So it does not give you an actual address. Oh, yep, it does. If you look at the Wikipedia page, it gives you information. I think that would make it easy to find the particular hospital. It looks like it is on River Street. But it, from what I understand, it's active development, so I don't know how close you can get to it.
All right, let's see. Teresa wants to know, I'm curious as to Munson State Hospital in Munson, Mass. What purpose did that institution serve?
Munson Developmental is an animal unto itself. When Munson was founded, so Massachusetts opened 3 almshouses for the poor all at once. Bridgewater, Tewksbury, and Munson. They all opened on the same day in 1854. Munson did not remain a poorhouse for very long. They ended up becoming a hospital for epileptics. And then eventually they became an orphanage of sorts. So they were taking in children who were homeless and placing them out in the communities. And eventually they became what's called a developmental center. So they served individuals with developmental disabilities and cognitive disabilities. So the history of Munson is so very different from almost every institution in Massachusetts. I think the only other one that has a weirder trajectory is Bridgewater. But Munson was a beautiful campus on the top of a hill in Munson, just over the bridge from Palmer. Absolutely beautiful campus. And right now, I think they have finally found a proposal for redevelopment. We haven't seen any movement on that yet. And the campus is highly secured, just FYI.
Briefly, Paul wants to know, what can you tell us about Penaquis Island in regards to leprosy?
Oh, so I don't know a ton about the leprosy part. I have a friend who was actually a research assistant in doing a study of leprosy at Worcester State Hospital when it caught fire in 1991. His name is Paul Johansson. He's a phenomenal resource for the leprosy piece. If you want to reach out to me, send me an email. You're more than welcome to do that, and I can connect you with folks if you want a more solid answer on that. And I'm gonna push this back to the beginning slide. So if anybody wants to grab my email, you can. I made too many slides clearly because it doesn't want to.
No such thing. Well, I'll include your email in the follow-up email as well.
Perfect. Perfect.
Oh, great, you're there. Linda, we'll do two more questions. Linda wants to know, and Linda, just so you know, Dr. Benson literally wrote the book on this. Linda wants to know, do you have any information on the TB hospital at the now defunct Danvers State Hospital?
Oh, yes. Actually, if you get my Images of America book on Danvers State Hospital, I do talk a little bit about the tuberculosis ward that was on the campus. Nearly every insane asylum ended up with a tuberculosis ward just because, again, you're in an institution and those types of diseases spread really quickly. But again, I do touch on that in the Danvers book. And I think we have a few pictures in there of the tuberculosis ward.
And a couple people asking about the Boston Floating Hospital. Rachel wants to know, what was the hospital used for?
The Boston Floating Hospital, the ship that I showed a picture of, that was kind of like a first attempt as people were coming into the port cities more and more. In order to isolate people without necessarily using Rainsford Island or Deer Island, they thought a floating hospital might work. But obviously you're just recreating the same conditions that you had in the ships coming over from Europe. So I don't know why they thought that was a great idea, but it's kind of neat. And then later on, I don't know if it's that exact ship, but there was a ship that was being used for something similar that they then briefly turned into a floating reform school. So Massachusetts really wanted something to happen on boats, I guess. I don't know.
There we go. So Dr. Benson, we've hit the 1 hour mark here, 8:05. So we'll start to wrap things up. Folks, let's give Dr. Benson another big virtual round of applause for a great presentation. Dr. Benson, any last words for the audience? Anything else you want to plug?
I absolutely love getting questions, stories. If you have something that is a burning question or you have anything to share, please feel free to reach out. And obviously, if you're interested in any of the institutional history, I write both nonfiction and fiction. I also will be teaching a course at UMass this fall on their online programs about disability advocacy and its history. So if you want to learn more about things like the state schools for people with developmental disabilities, it's an online course that you don't have to be part of a degree program for. You can come and enjoy a few weeks of talking about disability advocacy, and make sure that you visit the Public Health Museum. Without them, these types of presentations would not be possible. It's well worth seeing everything in the museum, especially since I just told you that they have an iron lung. You should definitely go and see that. And again, I would love to hear from you. Questions, thoughts, feedback, stories. I love it all. So thank you all so much for tuning in tonight and listening. And I appreciate all of the questions. Thank you all. And thank you, Robert, for hosting this. Much appreciated.
You made it easy for me, Dr. Benson. So, folks, let's see here. So, look for an email from me later tonight with a link to the recording. I want to thank Dr. Benson. I want to thank the Public Health Museum, in particular Amy and Paige, for all their assistance. And when you exit the Zoom, please take 60 seconds and fill out the feedback survey that should pop up. Your feedback is greatly, greatly appreciated. So thank you all so much, and I hope everyone enjoys the rest of their night. Thanks again, Dr. Benson.
You're welcome. Have a good night and support your public libraries.
All right.